Hello, and welcome to another edition of Riding in Cars with Researchers. I'm Dr. Jeff Kingsley. Today I'm going to answer a question that I frequently get from patients. If the study drug works for me, can I continue to take it at the end of the trial? Unfortunately, no. Usually no. Why? Okay. The point of research is to have a systemized process whereby we can look at the safety and efficacy of something stepwise, where piece by piece we learn more about the safety and the efficacy of something. That's why the whole thing exists, and that's why we can't just simply give experimental compounds to people without regulatory bodies like FDA, EMA, Health Canada, looking at and vetting and approving our ability to move forward, and IRBs doing the same. So that process works. That process is slow, but it exists for a reason. It exists to protect you, and that's a good thing. The downside is, if you got benefit in a research trial, usually at the end of that trial, you can't simply stay on the compound that we used. Now, what are the exceptions to that? I mentioned that sometimes there are exceptions. There are many protocol designs that have what are called open label extensions at the end of the trial. I have one going on right now in ADHD, attention deficit and hyperactivity disorder, where kids entered that trial, and for the first 12 weeks, they were in a randomized, placebo-controlled portion of the trial. But after those first 3 months, they went into an open label extension, meaning now I know that they are on the study drug, and I know precisely the dose of the study drug, and I can increase their dose, decrease their dose. There's no randomization, and they can stay on the drug for several years. So there's an example where if you were getting benefit, if it was working for you, now you can enter an open label extension and get several years worth of that medication for free. And they still get completely free healthcare. My visits with me are free, and all of that. So they still get all those benefits of the research experience. I really enjoy those trials that have open label extensions. It's a wonderful extra benefit for the patients. So look for trials like that. Now, here's another example where sometimes you can stay on the drug at the end of the trial. Well, the reality is many times trials aren't running one at a time, but rather there are multiple research protocols going on simultaneously. And so there are times where we're in the midst of one research protocol on a compound, and it gets FDA approval while we're doing the research. And so there's an example where at the end of the trial, you could actually get a prescription and go to a good old-fashioned pharmacy and get that compound, get that drug, because at that point it's officially called a drug. So the process is there to protect you. That's why at the end of a trial, most often you have to come off of the study drug, look for open label extension trials, and sometimes the drug gets FDA approval while you're in the trial. And so there's the full rationale. I hope that helps. As always, thanks for riding along. Follow us on social media. Reach out to me. Let me know what you think. Let me know if you want other topics. LinkedIn, Instagram, Facebook, and YouTube. Take care.